Maybe you're like me, you have carefully chosen a diet and exercise program, you take a dozen or more different pills every day. Each of them has real scientific evidence behind it, perhaps a study in mice or fruit flies or some effect on the biochemistry of aging that fits with your favorite theory. But we know that we're only making the best guess that science has to offer. We haven't been able to prove the worth of any of these measures because a clinical trial would take decades to complete. Aging happens very slowly, and the only way to be sure something is working is to give it to a lot of people and then wait and wait for some of them to die. We take many pills hoping that they will all work together, maybe a year or two of extra life from each one, and together they add up to the really substantial changes in life expectancy that we're all hoping for. But we know it's not likely to work that way. Chances are that taking a dozen pills just adds the same 3 years of life a dozen times over. Wouldn't we all like to know what really works? Best of all, wouldn't we like to know what combinations of pills and diets are really synergizing so that their effects compound? Just in the last few years, there's a new technology that lets us test what works. It's called methylation testing, and it's a simple saliva test that accurately measures your biological age. If you test at the beginning and end of a year, you can determine how fast you are aging during that time. You can be part of a study to determine what works to slow the aging process. We will ask you lots of questions, everything you do, every supplement and drug you take that might help to keep you young. You'll get a methylation test at the beginning and again after 2 years to see how fast your biological age is changing. At the end of 2 years, statisticians will look at these programs and all these methylation tests and see if there's a message in the data. Who is aging most slowly? Is there anyone whose biological age is actually getting younger? And is there a pattern in what these people are doing? If you decide to sign on with the DataBEaTA trial, we won't ask you to do anything different from what you are already doing, but we will ask you to tell us in detail about your personal program. You'll have free testing from True Diagnostic. From a sample of saliva that you provide, they will extract a full methylation profile. All of the latest epigenetic clocks can be computed from this data. Best of all, you'll be contributing to a study that can benefit us all. At the end of 2 years, if all goes well, we will know which of the many strategies we're using works best, and this is new, which strategies work together to significantly slow or reverse the aging process. DataBEaTA is an open source nonprofit. All our results will be placed in the public domain. DataBEaTA claims no intellectual property of its own.